Okay, we're going to start with metabolic fuel, and now we are still under the fed versus the fasting state and diabetes mellitus. So diabetes mellitus is just trying to explain the hormonal failure and the fed fast cycle. So what happens whenever your hormone is not functioning well? So we have what we call the type 1 diabetes, and we also have what we call the type 2 diabetes. So the type 1 diabetes is caused whenever you lack insulin, whenever there is no insulin in your body, or then your insulin production just suddenly stop. So the first state signaling in what's absent. So the enzyme, which is insulin, that is responsible for signal that hey, there is glucose in the body, there is carbohydrates, there is so many things in the blood. So what are you going to do to reduce them, or to in order to make use of them efficiently well? So your body don't have good source. Your body don't have good source of converting this glucose in the blood to what we can use. So what then will now happen? What will happen is it will start accumulating in the blood. So uncheck hepatic glucose output. Since your body now believe that there is no glucose functioning in our body, so what will happen is the glucose molecule or gluconeogenesis will occur. So gluconeogenesis, we are breaking down the fats in our body. In gluconeogenesis, we are breaking down glycogen in order to make glucose. So there is glucose already in the body plus what? Plus gluconeogenesis that will produce another glucose molecule in our body by breaking down fats, converting glycogen to glucose, and all the rest. Ketogenesis, ketone, in order to just make this glucose plus the glucose in our body. This will now lead to hyperglycemia, and this will also lead to what? Ketone production. And when there is large amount of ketone production, what should now happen to our body? What will just happen to our body is you start experiencing what we call type 1 diabetes. So there is no insulin, and actually it actually lead to stroke, death, and so many other things. So we also have the type 2 diabetes, and what happens in the type 2 diabetes is you'll have insulin, but it's not functioning very well. So the receptor signal, impaired receptor signal, is not functioning well. Your insulin is not functioning well. So when insulin is not functioning well, it leads to what? Simultaneous increase of what? Hyperglycemia. So whenever there is increase in hyperglycemia, that is what? There's high glucose level in our body, and there's no way they can convert them because there is no insulin. There is no insulin really, like there is insulin, but the insulin is not functioning. So what's going to happen is now leads to constantly increasing of hyperglycemia. From there, it now leads to what? Hyperlipidemia. It now leads to simultaneous hyperlipidemia. So what is hyperlipidemia? Hyperlipidemia is due to there is a high level of glucose in our blood, and there's nothing actually converting this glucose to what the cell can use, and this will now lead to increase in triglyceride in our body. From there, the blood keep on circulating it reaches to the vascular system in the brain. They are very tiny. What will now happen? It will now go there and block them, and as it blocks them, it now lead to stroke. Sometimes it can lead to death. And when stroke occur, what happens? Some of your body will now undergo what? Paralysis. They will not be able to move. So both form illustrates how hormonal failures and drills the elegant fed and what? Fast cycle states. So, hello, this is 2026. So go there, be successful and be productive, and make use best of this year. See you next time. Don't forget to like, subscribe, and hit the notification for more videos like this on Sagacious Learners.